So let's talk for a moment about health reform. What the CBO says is that this is going to generate more than $900 billion in new expenditures over the next 10 years. Now, there's a lot of reasons you could question some of this, but the number one budget item here is really subsidies for people who are purchasing health insurance that, through private insurers, okay? And it may not seem that big in these numbers, but as I'm sure all of you know, that's partly because the subsidies don't start right away. They're delayed for a few years. Then you have a risk pool for, basically this is for the high-risk risk pool where they have federal subsidies, another $106 billion, and a big Medicaid and S-CHIP expansion, which is going to be initially funded entirely by the federal government. As the states don't have to match up in the beginning, though gradually they'll have to pay a larger share of the expansion's costs. So think something north of $900 billion for the first 10 years for health reform. And then take a look at, remember, they've claimed deficit reducing. So there's going to be a $455 billion reduction in existing programs, disproportionate share payments to hospitals, which is a big issue for hospitals that care for a lot of uninsured people. That dish is going to be sort of eliminated and then it'll be brought back, but at a lower level as part of the legislation. And I'm sure you're well aware of the fees that will be imposed on device manufacturers, insurers, and there's this kind of funny thing that the pharmaceutical companies will have to pay. It's not entirely clear to me how much this actually really costs them in the end. And then a $210 billion increase in that Medicare Part A tax, the hospital insurance tax. So as I mentioned, the projection was this would reduce the deficit over 10 years. CBO is very reluctant to make projections beyond 10 years, and for good reason, but they claim that the deficit reduction will be even greater in the years beyond that first 10 years. So this bill, which is really two bills, is doing a lot. It's doing a lot financially, and it's doing a lot in terms of changing rules under which we operate. And again, those of you who have looked at the bill have probably find all kinds of hidden things or things that you haven't read about in the press coverage, and it's just coming out in dribs and drabs as you read, as people read through and start to try to understand the implications. I want to focus now on the implications of the reform bills for healthcare delivery and payment, because I think this is going to change your strategy ultimately for getting products into this market, but also it might affect your thinking about what kinds of products will be most needed going forward. And there are some principles that drove the reform effort, and we could debate, as many of us have, I'm sure many of you have, about what effects the reform bill will actually have in these areas, because some of the features that would have given the Secretary of HHS a lot of power to make change happen were stripped away in the legislative process. But this is where they want to go. So you may think about this unequivocally as being what the goals are, and then you could debate whether it will achieve these things. The intent is to give healthcare providers more financial responsibility, to give patients better information about the quality of care that they might receive from different providers, and ultimately to transform payment from a predominantly fee-for-service mode, which rewards volume, to one that rewards quality, better health outcomes. That is the goal. And again, you could debate about whether it will achieve this goal. But that is clearly what was behind a lot of the changes. So a few of the features I think you're familiar with this. One of them is the creation of health insurance exchanges. Now, health insurance exchanges have a very limited role in the legislation. They apply to individuals and they apply to small businesses. But the intent is not to have large employers give up offering health insurance and move their employees into exchanges. And this was something that was negotiated a lot. There were amendments and alternative bills that would have given exchanges a much bigger role, but they didn't make it through. So clearly Congress wanted to go part way, but not all the way with creating exchanges. And just by way of disclosure, I've been a long-standing fan of health insurance exchanges. I'm a part-time federal employee. I work for the VA. I get my insurance through the Federal Employees Health Benefits Program, the same way people in Congress do and the same way federal officials do. I think it's a great system. There's very high levels of satisfaction with that, and the FEHBP is the inspiration largely for the concept of exchanges. And it's been in many kinds of health reform plans, including a couple that I helped to draft. So I like the idea, and one of the things I like about it is it gives people choice. It's a choice among private health insurance plans. In the legislation, there's the idea of creating co-ops. Personally, I think co-ops don't matter much one way or the other, and I didn't think a public plan was very, what a public plan would do depended completely on the parameters under which it operated. It could turn into a tiny, insignificant fraction of the market, or it could take over the market depending on how it's designed. In any case, we don't have a public plan, and the co-ops I don't expect to behave very differently from a conventional commercial health insurance plan. But the idea is more transparency, more choice. Plans have to compete on cost and quality. And there are measures to control adverse selection, which are not very well spelled out, actually, to my reading. And that's something that might be spelled out more in the rulemaking phase. The reason you should be concerned about exchanges, or why it might be of interest, is that exchanges are designed to increase the focus on value. If people choose a more expensive, more generous health insurance plan, they will pay the difference out of pocket.